I'm Atlanta dentist Andrew Kokabi of Brookhaven Family Dentistry, and I'm coming to you live from the lovely waiting room of our dental practice here in Brookhaven, Georgia, right outside of Atlanta. And today I'm going to answer an interesting question, and that is, does my gum recession need a filling? So, if you're watching this video, chances are good you've got something going on right at your gum line, and someone has maybe told you you need a filling on it, and you want to learn more about it. Often, I'll have patients come into my office for a second opinion because our office has a reputation for being very minimally invasive and being very conservative in our treatment recommendations. We only think of drilling as a last resort. So people will come in and say, well, doc, I've had this thing in my gum line for a long time and it hasn't bothered me. Do I really need a filling on it? And let's figure it out. First of all, what is gum recession and abfraction lesions? Gum recession is pretty simple. Regularly, your gums are all the way up here. So if you've got gum recession, your gums have receded down here, exposing the root of your tooth. This is the top of your tooth, this is the bottom of your tooth, and usually this is covered by gums. Gums follow the bone, so a lot of times when you have gum recession, you also have bone loss in that area. Abfraction lesions are a little similar, but a little different as well. Usually you do have a little bit of gum recession, but also your tooth has a divot in it. So once again, this is your enamel, and there used to be enamel here, but your tooth has kind of caved in and has a little hole in it. That's the technical term for it is an abfraction lesion, which no regular person ever has heard of probably. All right, let's go over two situations where I definitely feel like you should get fillings on teeth that have gum recession or abfraction lesions. Number one, if there is cavities or decay at the gum line. What that means is your tooth structure used to be healthy and kind of look like this or like this, and now it's kind of rotted out and maybe it's brown, but either way, when I poke at it with my sharp instrument right in there, my instrument gets stuck in it, and usually you'll say ouch when I do that. That's a sign that your tooth has started rotting out and decaying at your gum line, and in those situations, I definitely recommend a filling. That's a good thing to do. Another situation is if you've got sensitivity, but the sensitivity hasn't gone away with non-invasive measures. And what I mean by that is, once again, at my dental office, we really don't want to drill on your teeth. So if someone comes in and they've got gum recession and it's resulted in sensitivity, but they haven't tried anything for it. They say, when I drink cold stuff, it bothers me, but they haven't tried over-the-counter sensitivity toothpaste. Sometimes something as simple as that will make your sensitivity go away, and it's non-invasive. It doesn't require us drilling on your teeth. Other times they have tried over-the-counter sensitivity toothpaste, and so we try to bump it up and give them something stronger. We give them either prescription strength toothpaste or some kind of fluoride treatment that once again is non-invasive. It does not involve us drilling on your teeth, but it kind of puts a little layer of protection over your tooth and makes your sensitivity go away. So the two situations where I feel comfortable telling you need a filling for your gum recession is one, if you have cavities, and two, if you have sensitivity where the sensitivity has not gone away with less invasive options such as toothpaste or fluoride. Now, aesthetics. Well, that's beauty is an eye of the beholder. So aesthetics by itself is not enough reason for me to tell you that you need to have fillings on abfraction lesions. Usually it doesn't make that much of a difference aesthetically. A lot of times these areas are not visible. So if you have an abfraction lesion way back there in an area that's not visible and we do a filling on it, well, okay, it looks great, but no one's ever going to see it. So aesthetics, I leave that up to the patient. If it bothers you, I'm certainly happy to do a filling on it. But if it's not bothering you and you don't even know it's there, I'm not in a hurry to put a filling on that. So yeah, those are pretty much the only reasons. cavities, sensitivity where it has not gone away with non-invasive measures, and aesthetic situations where the patient has told me, I really don't like the way this looks, please do something. Then I'm certainly happy to drill on your teeth and do fillings for these areas. Now, why am I even making this video? Why am I so opinionated on this? And here is why. I have seen way too many situations where teeth that had small abfraction lesions that weren't really bothering the patient and they weren't really changing, they hadn't gotten worse over the years, and a dentist went and did fillings on them. Well, first of all, when you do a filling, you can't just glue the filling onto the tooth. You have to drill away a little bit of that tooth. So you're taking a tooth where the patient has no problems, you're drilling away some of it, healthy tooth structure, and you're gluing on this filling. And a lot of the time, the filling won't even stay in there. A lot of the time, for abfraction lesion fillings, they have a tendency to just pop off your teeth. That's because, other than the glue that we're using to put them on there with, there's nothing really else holding them in place. So what happens then? Well, you've already had some tooth structure removed. Now the doctor goes back in there and drills a little bit more tooth structure and puts a new filling in there, which may pop off again. So you're getting into this terrible cycle of having to have healthy tooth structure removed. And at some point, as a result of drilling away all this tooth structure, yeah, your tooth is going to develop problems. So this is why I am not very aggressive when it comes to recommending fillings on abfraction lesions. In my 20-something years of being in the dental world, I've seen lots of problems happen with teeth like this. Other dentists may disagree with me, and to each his or her own, and if they have found a way to do fillings on abfraction lesions that work great and they don't fall off and they don't give their patients any problems, then by all means, I think it's fine for them to do whatever they want. But in my office, this is our approach to treating areas of gum recession and abfraction lesions, and it's worked great for us for many years, so we're going to probably keep doing it forever. So, anyway, I hope that helps and answers some of your questions in regards to your gum recession or abfraction lesions. Once again, I'm Atlanta dentist Andrew Kokabi of Brookhaven Family Dentistry, and we've got this wonderful dental office here right outside of Atlanta, and in my opinion, this is the greatest dental office in all the world. It's a pretty good place. We've got some very kind-hearted and gentle hygienists who do excellent cleanings on our patients, and we've got some great front office team members and assistants, and the dentist isn't that bad either. I guess I'm somewhat okay. No, I'm just kidding. I'm okay. Anyway, thanks for checking out this video. Hope you have a great rest of your day, and we'll see you later. Hi, once again, I'm Atlanta dentist Andrew Kokabi of Brookhaven Family Dentistry, and I hope you enjoyed the video. If you did, do me a favor and click the thumbs up button on the bottom of the screen. Also, if you live in the Atlanta area, then congratulations, because you live in a town where we have hundreds of wonderful dental offices, and ours is certainly one of them. I will say this though, we are one of only 3 offices in the North Atlanta area that have not only a perfect 5-star rating on Google, but also have over 600 Google reviews. So I'm pretty proud of that. Anyway, yeah, feel free to give us a call or stop by and say hi. Thanks.